Namaste. Today we are talking about free parking under the subject psychoanalysis. Ever since Beyond brought to the center stage the concept of containment, the concept of reverse containment, that is, children being used as containers by pathological parents, often comes up for consideration. Our conversation today will be on the subject of reverse containment with Mr. Himanshu Vaidya. Namaste, Mr. Vaidya.
Namaste.
Should we start with what is this concept of containment as proposed by Beyond?
Beyond proposed this very important concept of containment, and he started off by looking at the interaction of the infant with the mother. When the infant who does not yet have language is hungry or is afraid or is not feeling well, there is a feeling of distress, but there is no understanding of it. It is what is called the nameless distress. And one form of the nameless distress is what happens when you get anxiety, but you don't know what it is about. Beyond calls it the nameless dread, a dread about which you don't have a name for it. So now what happens is the infant has all this anxiety, all this distress, but he does not know what to do about it. He cannot understand it. So all that he can do is he can cry and he can throw around his arms and legs, or he can just feel the distress. It is in this point that the mother comes and understands intuitively that the infant is hungry or is afraid, and she soothes it by either giving the milk or by talking to him and trying to allay his fears. Two things happen here in this interaction. One, the infant feels he is protected by somebody who is quite potent, almost omnipotent. Two, that person gives a name to this inchoate distress. And Beyond says a very important thing. He says the name closes an infinity. That the moment you give a name, yes, you are hungry, that closes this infinity of possibilities, because the child has opened up an infinity of possibilities. He does not know what it is. The moment you say it is one and nothing else, it closes the infinity. This happens in the adult state also. When somebody comes with a psychological problem and the infinity is open, he's thinking of 100 things what has happened to him. And the moment you give him a label, it is only this, and this happens to many people, suddenly the infinity closes. And he feels slightly at home, slightly less anxious, because now he knows he only has one thing and not hundreds of things. So one, the name closes the infinity, and second, the child expresses distress, and the child also, by projective identification, puts distress into the mother, because this is pre-linguistic communication. So the mother intuitively knows, because of the method of projective identification, that when the mother in the first 9 months is in the state of what Winnicott calls the maternal reverie, there is a kind of an unconscious, non-linguistic communication between the child and the mother. And that happens primarily through projective identification. And when the mother receives that distress and also sees that distress expressed, but does not respond to it with distress, she continues to be peaceful. Right? So what is happening is, in a way, she is offering him a system where the input is distress, but the output is happiness, peace, and assurance. So in a way, her self as a system is taking in raw material, processing it, and giving back finished product. The raw material taken in is of distress, anxiety, all the difficult emotions. And what is given out is happiness, assurance, love, security, holding. So in a way, she is not only a container, that not only she contains, she actually processes what she contains and gives back a positive processed output to the child. So here what we see is that one, we need somebody to contain, we need somebody to process our material, and we need somebody to give back the positive processed material to us. So this phenomena is what beyond name as containment. So in the most basic form, it is like what the child is throwing out, the mother just absorbs it, looks at it, and just maintains her composure, which is a kind of a passive containment. The second is the mother is not only a storage box, but an active processor. She actively processes that, makes sense out of it, gives it a name, and along with the name, gives back emotions which are very positive and qualitatively very different than what has come in. So she is doing active containment, where she is processing what is contained and giving back something more. Later part of life, beyond reflected upon, that is the same thing happening in therapy. That the therapist is presenting himself as a very good container, and some therapies can be just containers, passive containers, good passive containers. Some may be active, good active containers, and some go to a next level, what he calls the ineffable O. And that is where beyond goes mystical. That ineffable O is a very specific kind of a state into which you go, in which you don't say anything, you don't do anything, but somehow your system receives what the patient says. In some sense, either it provides an environment or it provides the processing, but the patient is able to get well in that state of when the therapist is in that state where the ineffable O happens. A unique kind of healing happens, and that would be a very specific kind of containment from another point of view. And then the question comes, how do we get into that state of ineffable O? And in spirituality, when we look at it, the state of no mind, no thought, somewhere near to that, a few steps before it, you have this state of ineffable O. And this often happens towards the end of the session, that you feel there are no thoughts going on, not much thoughts going on, not much feelings inside of you. There is a kind of an emptiness, a very positive emptiness. And that state, in that state, the person says something and you don't say anything. And often the person sighs, that kind of thing. And after some time, the person is able to modify himself. It was almost as though he was waiting for this. That I don't want active interpretation. I don't want advice. I don't want anything. Just let me say out what I want to say. And after it is said and accepted unconditionally, I will be in a state where I will be able to modify myself. And Beyond says it very well. He says, if only the therapist can hold back his brilliance for a moment, the patient will say what the therapist wants him to say on his own. So this is where the concept of containment is. It's a very important phenomena in the infant life of the child, and that creates templates on which the adult personality, not on which only, but that creates very important templates of the adult personality and also for adult pathology.
So, in other words, and in short, the mother becomes the positive, reassuring container for the child.
Correct. Correct.
So now the next question is there something called no containment or pathological containment?
Yes. So what we talked about was the ideal.
Right.
But all mothers are not equipped to be good containers. Let us say you are bringing up the child and you are not able to sleep for 2 or 3 days. After that, any person will get irritated. It's a 24/7 duty and nobody can do it indefinitely. But to what extent do you get irritated when the child throws a tantrum or he is into distress and is crying out? So you will have three kinds of mothers. Mothers who are able to do positive containment. Keep smiling, keep being steady, composed. Second, those who cannot do positive containment but can do neutral containment. That they may not be able to give back something positive, but in just a neutral way or just above the neutral way, with some happiness, they can do it. And the third category will be where the mothers also get irritated and they also throw a tantrum along with the child. They also scold back the child. So what happens in the third case is the child very soon realizes that this expression of difficult material, difficult emotions, difficult screams is met with fears of loss or attack. Either the mother moves away or the mother screams back. So either it is loss or attack. And very soon he realizes that if I want to be close to the mother and have all the good things from the mother, including security and survival ensurement, then I better keep the mother pleased. And one way to do it is to hold everything into myself and not put it to her. So this is where no containment happens or the no containment happens. Then you will have another group where the mothers are so full of anxiety and so dysregulated that the mothers throw that dysregulation in the atmosphere and the child sees everyone else in a peaceful, composed state, silent state, trying to contain the mother. And over a period of time, the child also learns it. And this is a kind of a reverse containment. That instead of mother containing the child, now the child contains the mother. And this is a very pathological development. Because this is not something which is expected. And over a period of time, the child develops the templates that he becomes like a free parking space for emotions of others. On the face of it, people can think he is a very good listener, he is a very calm person, but often inside things can be boiling. And when such a personality crosses the mid-age, in all probability, they will be visiting some therapist or some psychiatrist because there are limits to how much you can contain without expressing. The moment buckets are full and the overflow starts, and it is very natural because this is all that you have learned. The template is if you don't allow the free parking space to the other will leave or attack, or the other will withhold good things from you. And the second part is, if you express yourself, you become a burden to the other. And you don't have a right to ask. And therefore, this constant obsession that I should not be a burden to anybody. And if I open myself, I'll be a burden. And this constant thing that I cannot ask, I don't have a right to ask. This leads to prioritizing the other over oneself and keeping oneself at the end of the priority, often at no priority. So this is what happens when you have no containment or reverse containment. And okay, and this will lead to personality disorders or psychosis or any other kind of thing in the long.
Okay, you just explain no contentment or pathological contentment and maybe reverse contentment also. So can we like go into a little bit of detail how this free parking happens into a child as a container?
Correct. So when the child is too young, he is yet to make out completely that the mother is incapable of being a good container and she expects him to be a container. So the mother is looking for her mother in the child. So she never got a mother who provided her good containment, and therefore she has never learned it how to be a good container. And this is very important. It's often transgenerational. That if our mothers have not learned containment, it's very difficult that we would learn containment unless we are very aware about it and we know of these concepts, or somebody talks about it in indirect ways. When the child grows up, initially the child is just throwing around everything, and it's just like a contest between the two. Now, what happens in that contest between two dysregulated people is the child never develops the capability of self-soothing. He never develops the capability to be confident that I will be able to contain this stress and not be overwhelmed by it. So the response template that the child learns is, at the smallest of challenge, disintegrate and get off into a fountain of anxiety. And he learns automatically catastrophic thinking. Then at the drop of a hat, whenever something is to be thought about, always think catastrophically and always end up with mounting fountain of anxiety. So this is what child learns because this is what he sees the parents do. On this point, there is also a socio-economic aspect to it. Lower down in the economic ladder, the catastrophic thinking is very real because the threat to survival itself is real. And at that level, catastrophic thinking actually is positive because the more you have it, the more you rehearse it, the more you prepare, and therefore better are the chances of coping if it comes true. It's like you do threat rehearsal all the time because the situation is such that threat can actually come true anytime. Now, that is something that children will learn from their parents. But higher up in the economic thing, in hierarchy, it is more the psychological transgenerational phenomenon. That they don't learn self-soothing. They don't learn not to disintegrate in the face of challenge. They don't learn to contain the things you have to do which are not pleasurable. They don't learn how not to be on the torture reverie continuum. Because those who don't have a good containing capacity usually are on that continuum. That either they are in the state of reverie, where they have nothing to do and they are at rest and peace. And the moment some challenge comes up, they are on the opposite end of it, which they feel as torture. So every small thing is converted into a big challenge and ultimately into a torture. And the opposite of it is to be free from everything and be at rest and be at peace when you are not bothered by anything. And that is the state of reverie, where slowly the thoughts are going on. You don't have any time challenge to perform anything. You don't have any people to scrutinize you. You don't have to show anything at a given point in time. There is nothing to be done by you. You are not to be held accountable to anybody. In a way, you are free from reality. So then you see reality as torture and you always run back to the state of reverie because you have never learned how to transfer pleasure to a state of reality. And this is very important, that the child has to learn to transfer the pleasure of reverie into work. Only then he'll be able to work. Otherwise, if the pleasure is not transferred, work looks like torture and nobody can endure torture beyond a point. And that is true of so many people that you find most people escaping from work. And in that, there are many reasons. One is the injustice, that they feel they are not rewarded enough. That is one part. Second is the sheer feudal hierarchy, that somebody is bossing around without any reason. Third can be the Oedipal transference or the Kleinian bad batch transference on the authority figures. There can be some other reasons, but one of the reasons also can be this, of being on the reverie torture continuum and having never learned soothing and containment. So this is one part of it. The second part of it is the child learns that if he needs the minimum that he is getting, he has to offer the free parking space. If he has to save himself from attack of the mother, he has to offer a safe parking space. At times it can even be attack of the caregiver, maybe the father or somebody else is looking after, and he has even less containing capacity than the mother. So the caregiver behavior is very important. And very soon the child learns that if I don't want attack, I have to hold back things into myself. Now that has 2-3 implications. If the child has good constitution and he in course of time meets some good containers from where he learns containment, then he will be able to contain it for a very long time and offer a parking space for a very long time. Maybe till the midlife crisis, maybe till the 40s. But if he never learns containment from any good container around and he himself does not have constitutionally a good capacity, then things are very bad. Another possibility is that in the first 2-3 months, the child has good experience and after some time, the parents get tired of it. And the outcomes are very different. Let us say you have good experience for a few months and then you have these difficult containing experiences. Chances are more you will develop a personality disorder. But if right from the start you don't have good experiences, there will be more chances of taking a psychotic turn or an impulse control disorder turn. Because the self-regulation is not in place, self-soothing is not in place, the capability to repress difficult things is not in place. The whole ego is not trained, because ego trains itself by looking at others. So one person's ego learns from the other person's ego. And if you don't find good egos around you, you learn whatever is around you. And whatever is around you are broken egos, weak egos, disintegrated, dysregulated egos. So very soon he learns that if he wants parents, if he wants to avoid loss, attack, and wants good things from parents, he has to offer free parking space. Often this is fortified when he goes out into the school and society. That when he does the same thing with others, often he finds others like him more. That you have a very composed and a clever and a wise child. So then another kind of incentive comes in. That he gets praised for it. He gets good interactions out of it. He often gets rewarded for it. And that fortifies it. So now you have a great man in the making. The selfless great man. And that great man will continue till midlife. Or if he does not have anything, then there will be explosions. For example, right from the start, he has not developed any containing, has not learned from anybody, does not have constitutionally good things. Then what will happen is right from childhood, he will be a difficult person and will have fights everywhere, eruptions everywhere, unpredictability everywhere. So then we are looking at the foundation of something psychotic.
Okay, so partly we have looked at some characteristics of not having good containment. Can we go into the detail is actually what happens when the child, he or she grows up?
When the child grows up, many things happen. First is, as an adult, he continues the same pattern, the same template. 2, he has a problem of asking anybody. He doesn't feel he has a right to ask. So the core problem is the right to ask. He doesn't feel he has a right to ask. 3rd, he feels he'll be a burden to everybody if he asks for anything. 4th, he fears if he asks and somebody does something for him, then what price will he extract? 4th is he does not know how to find somebody as a parking space. So what will happen is he will not express his emotions to anybody. So he will be like a giving person, duty, all duty and no beauty, all idealism and no pleasure. So he will be always a giving person with a problem of right to ask. And in all probability, there will be somatization. So in all probability, some psychosomatic sickness will come up. Blood pressure is very common. Some skin issue is very common. Any autoimmune problem is very common. He also can succeed as a leader, but he'll always be seen as a very giving, generous person. And he will find it difficult to follow a procedure where he has to exert authority and follow a system to the last T. And in some cases, it will go to pathology. Like either it will be personality disorder or psychosis or an impulse related problem. In therapy, when they come, one of the things is how do you ask? That's one of the central things. And not prioritizing oneself. So in therapy, often I ask them to write down articulation of desire. What is your desire? And usually they have never reflected upon it, never prioritized it. So it is not only a free parking space in the sense of containment. The parking space actually expands in a way that they become the parking spaces for desires of the other. So then over a period of time, they start living the desire of the other more and desire of oneself very less. And often they are seen as very good, very calm people, but inwardly they are quite unhappy. At office or at home, people can see them as very good people, but inwardly they are deeply unhappy. In a way, because they have never lived out the real center of themselves. To use Winnicott's language, they are always living out the false self that they have put up in order to adjust with reality, but inside the real self is completely untouched. So it's like a premature maturity. Like you can see a small boy in India on the tea shop, and the boy is hardly of 8-10 years, and people who are 35-40, they expect him to be as focused and as efficient as them. And they force him into that thing, to quickly do the work, to focus only upon the work, not to look here and there, not to go into play, not to explore anything. And in a way, he gets trained. But then what is happening is, he has put up a false self of 35 years at the age of 10 years. He has not made a gradual organic transition from here to here. There is a gap in between. You just have two things unrelated to each other. And he is living out of this. And this is completely unlived out. So that is the kind of situation we see, that free parking space of containment often expands into a free parking space for the desire of the other. And one never feels one has actually lived out oneself.
So, if there is pathological containment, then I mean, is it very likely that there will be personality disorders or psychosis
Yes.
as the child, he or she grows up?
Like any problem, you can put into three categories of intensity: mild, moderate, severe. Once we look at moderate or severe level difficulty of containment, then we are definitely looking at these two: personality disorders and psychosis. So in personality disorders, we often find it histrionic personality disorder, the problem of asking. In dependent personality disorder, the problem of asking, the problem of receiving. In avoidant, there is a fear of reverse containment. In paranoid, there is a constant fear of reverse containment or attack. And in psychosis, many times we find that people who come for therapy, they never have had good containers in their life. There was no corner where they could go and safely say what they feel, what they want to say. And therefore, internalization of a safe object is a critical element then in their healing. That all the objects in their lives have either been threatening loss or attacking. They never had well-regulated, humane, peaceful, containing, encouraging, supporting objects. So the objects either were fault-finding or they were dysregulated and shouting and turbulent, or those who would go cold if you don't do what they want. Quite kind of a passive aggression. But they never had positive, accommodating, peaceful, happy, well-regulated objects in their life. So one of the core difficulties there is of, and the core goal also is of, internalizing a good, reliable, stable object, which the therapist presents himself as one. And there the point is one has to be cautious and hold back as many interpretations as you can till the person feels safe. The first point there is safety. And after that, you can start with those interpretations. So the coercion method there works very well. And we see both of them in both these cases, personality disorder and psychosis. There are many reasons why they happen and why they are sustained and why they worsen. But one of the things that you always find is lack of positive containment. And therefore, often in therapy, I hold back saying anything for much of the session. And after some time, the person feels very relaxed and healed because that works. And of course, silences of various types. You can have threatening silences and you can have positive silences. So we are talking of positive silence, not of a threatening silence.
Right. Maybe like talking about containing, so that containing kind of silence, I think, which is reassuring.
Correct. Correct. So in that sense, we are offering a holding space.
Right.
And the therapy room and the frame of therapy, that you come only at a particular time, you are there only for a particular time, the day, the place, the time is fixed. That frame of therapy also provides a containing.
Right.
Because when somebody is in psychotic state or a florid personality disorder state, he feels like a leaf in the wind. And he wants to hold on to any branch which is stable. And the frame of therapy provides that branch to contain that anxiety, that difficulty, that distress, that in everything which is in their life of flux, the therapy frame is a constant. That the place is the same, time is the same, duration is the same, day is the same. So that provides a constant in the flux of things. So that becomes a kind of a scaffolding, kind of a holding for that anxiety. And the amoral and all-accepting stance of the therapist provides a safety. So you have the stability, predictability by the frame, and the safety from the therapist.
So how can we really know if one is suffering from this kind of containment issues?
That is very good question. It's very difficult because human mind has a characteristic to normalize everything.
Right.
Whatever you are used to, it seems very normal.
Right.
Like some children who were born in prison because their mothers were pregnant when they were sentenced. They grew up there and they found it quite normal. So that being the situation, they often don't know till they see an alternative very vividly, because their defenses don't allow them to see anything vividly which is contrary. Because the moment they see it, it will be huge amount of pain. They will realize all the suffering they have been through till then. And that will call for huge amount of mourning. Because the day you discover, till that day, you are suffering. And that's huge amount of mourning to be done. So defenses don't allow you that day should come. And that is where the person normalizes, person diverts his attention. He will do everything, keep himself busy, but not look inside. It is when they come to therapy and somebody tells them that what you say normal is not normal.
Right.
You have normalized the non-normal. Actually, it's not normal. So suddenly the person gets a jolt and sadness starts surfacing, often with tears in the eyes. What happened to his life? Where has life brought him to? And why should all this have happened to him? For what? So that state one goes into. And often it happens in therapy that one is suddenly jolted out of like a sleep-like state to realize that it is not normal. That what he calls normal actually is suffering. He has normalized suffering. And he has said goodbye to the real part of himself.
But what happens to people who don't really come to therapy? I mean, they keep leading the so-called normal lives because of the socio-cultural, familial support systems or the environment around, which happens in most cases, I think.
Correct. So one is in therapy, they are jolted out. Second, something happens and they talk to somebody and they are jolted out. Third is they read some spiritual books or self-help books and they are jolted out. Fourth is they see people for whom they are doing so much in a very selfish way. I mean, being very selfish. And that jolts them out. Okay, I am doing so much and why this reciprocation of this type? And then the inquiry starts and they are jolted out of it. Often they talk to their friends and they see it's a very different life. And often as they age, initially they like it so much because everyone is dependent on them, everyone admires. But as age goes, they start questioning, okay, why should I be doing what nobody else is doing? Often they have to do something when they don't have money or they have to take loan, then they are jolted out. Okay, why should I be doing this? So this is one. Second, they can be jolted out by sheer development of a psychological problem or a psychosomatic sickness. That if it overflows, then the symptoms will force them to rethink. And if neither of it happens, as you rightly said, then they just keep on living their life. And often you see them enjoying art and somehow trying to indirectly satisfy their desires or live out through art. And often they develop a lot of psychosomatic sicknesses. And many of them will also pass away much sooner than it would be otherwise. Because at some point they realize there is no point in life. And midlife is something that very few of them will be able to avoid without a crisis. So midlife is yet another point where they'll be shaken up. So there'll be one group which will just go on, another group which will develop severe psychosomatic sicknesses and pass away very soon, sooner than most. Third, they will be jolted out. And fourth, midlife will force them to look at the problem. Like Jung said, what Jung said, the stroke of the noon. That when the stroke of the noon happens, it is a kind of an autotherapist inside of us. that he brings up problems and forces us to acknowledge and address. He does not leave us the choice to use defenses and bypass them. So that stroke of the noon and that inward desire for health at a very deep level, that also can jolt us out. So this is how people carry on with the things. And also they pass on as adults the same thing in the next generation often. That many times they pass on either the pathological dysregulation or the pathological regulation, containment, sorry.
Right. Okay, so the fortunate ones who come to the therapy situation or therapist or a therapy room, I mean, how does this alliance work in detail? Can you explain? You mentioned a couple of times.
Right. So what happens is in therapy also, they do the same thing. They still feel if they express difficult part of themselves, they'll be burdening the therapist. They say it openly. They still fear that if they express difficult feelings, the therapist will hit back. So all that is in life gets played out in therapy. So it will play out. Contrary to all the previous experiences, when they see the therapist as a good, reliable, stable, safe person, and the therapy space as a safe space, and we should mention the word safety here explicitly to the patient, that feel safe to feel your emotions, feel safe in this space, feel safe with me, feel safe. And that once it happens, he is able to internalize the safe space of therapy inside of him. And that takes a long time because internalization is a slow process. And often the person will check you out, test you. There will be an examination that he will do some passive aggressive thing and see how far you can contain. He will do projective identification and see how far you can contain. Because they will test you out. Okay, will you attack or will you be able to contain? Are you different from those earlier in life or are you one of them? So they will test you out. Slowly, if everything goes well, over a period of time, he will internalize a good, reliable, stable object. He will internalize a safe, peaceful place. So don't make too many noises. The silence of the therapy room is also very therapeutic. Because therapy happens both in words and not in words. There is a verbal part of therapy and there is a non-verbal part of therapy. And the non-verbal part of therapy has to do with silences, with internalization of peace, with uncritical or moral acceptance, with positivity, with containment. All of these are aspects of the non-verbal part of therapy. How you handle transference, how you handle projective identification. So all this goes on in therapy. We have to start with safety and we have to ask the person to release his difficult thoughts and feelings and not make too many interpretations, not give advices too much, hold back our brilliance and put this on the discussion, the right to ask. It's a very important thing. And the second is, how does this parking happen and how does it feel? And there, when the patient reports real life interactions with people, you can analyze that with the patient and say, okay, look at what is happening. That in your interactions with people, you are offering free parking space. And in your life, there is nobody where you can park. So you need to find people because we all need temporary parking spaces. That when we are extremely dysregulated in anxiety, we need somebody to be with us and say, don't worry, everything will be okay. And he should not be as distressed as we are. Otherwise, we will have to console him. No, you also be okay. So we all need good containers and critical parts of life. So this is something that we have to point out. Another thing we have to point out is, what is your mood at home and outside? Many people are extremely reserved and angry at home, but very gregarious with their friends. Which means that there's something at home which does not allow them to be equally happy and gregarious. One element is of repression, which is necessary for discipline and some do's and don'ts of the fundamentals of human society. But the second part has to do with pathology at home. And there we have to see that when we stand with somebody, what do we feel? That we were alone, we were in state A. Now this person comes to interact with us, and we see state A has changed to state B. This person goes away, and after some time we return back to state A. So what I say, in his presence, that in presence of every person, something happens inside of us. And that has to do with many things, including containment. So one of the things we have to bring to the notice of the person is, how does he feel in the presence of various people? And in that thing, what all is in process, including the process of containment. And once that comes to the awareness of the person, then he can do something. In fact, I have created one small exercise as a tool. The title of that is In His Presence. Because this is very common. Often with people, you can feel, with somebody you feel irritated, you feel angry. With somebody you feel very insecure, that if I say something, he will criticize.
Or even this happens kind of completely unknowingly. If we are sitting in a, say, in a queue somewhere or in a room where there are people, and suddenly you feel uneasy or you feel heavy, burden, or sometimes you feel better.
Correct.
And you don't know who is doing what, or even like you are not aware of you talking, you're, I mean, kind of receiving something from a particular person, but something like this happens.
True. And we don't know the mechanism, but the fact is not in question.
Right.
For example, there are two clinical criteria which all psychiatrists use. That when a person who is manic is in front of you, you feel happy. The happiness is infectious. And when you are in presence of a histrionic person, you feel seduced. Right? So this is very, very factual. It's not something which is mysterious. The fact of this being there is not in question. The process of how it happens, we don't know. That how the transfer is taking place. It's like in quantum physics, what they call entanglement. That's a similar kind of emotional process is happening.
Right. Yeah.
Right? In projective identification, in containment, in putting things into people. So it's very important that we bring it to the notice of the person. The third is, in therapy of somebody with difficult container, it takes a long time before the person is able to go to catharsis. That catharsis is very necessary, but finds it difficult because it doubts the containing capacity of the therapist. And fourth, so we need to empty out all that has been put inside. Fourth is articulation of desire. To help the person find what is your real desire. What is it that you have not lived out? And fifth is to prioritize himself. That do good to yourself before you do good to others. And sixth is to be away from the parasites. Because the parasites in society are always in lookout for this type of people. And seventh is to work on I am good enough and not be terrified of loneliness or abandonment. So these are some of the things which which come up in therapy, and they will test you very, very rigorously. It will take a long time before actually catharsis or deeper analysis happens.
Now, how can one really heal from this containment issue, especially the one who has faced this from infancy or from a very young age?
Uh, First is to be told about it, that the first station on the journey is the person realizes he has a problem to be solved, that everything is not normal. There is a problem inside of him and the problem has to be solved. Number two, he has to be ready to try something new, including trusting the therapist. Number three, he has to be courageous enough to undertake a change in his social image, because as he stops doing what he has been doing and he starts a new life, which is a more healthy life, people will start making remarks. And that one has to have the courage to go through. Fourth, not fear loss in the process, because the parasites inevitably will run away. Fifth is to demand equal terms in relationships. And for that also one needs courage to put aside the fears of loss and attack. And sixth is to be judicious about it, not to be rash in that transformation. And in this thing, once you know it, you read about it and you also use as many tools as you feel help you. Maybe art therapy, maybe something else. Take help of anything that helps you. And with help of moderate term therapy to long term therapy, the healing definitely will happen. And in this kind of issues, psychoanalytic psychotherapy is the best. Because if you do ISTD kind of thing, they are not geared for containment. They are geared for challenge and confrontation with those who already have good containment. And when we are talking of esoteric things like internalization of an object, problems that come in the way of internalization of an object, then we are deep into psychoanalytic theory. This cannot be done by a CBT kind of thing. Now, exceptions can be there, that there may be a therapist who does not know psychoanalysis, but he's just felt too safe, too soft, too giving, and maybe the person overrides the efficacy of knowledge. So we have both here, knowledge and person. Because if you are a very knowledgeable person, somebody gets the demeanor of somebody attacking, somebody demanding, it's very difficult for that person to unknowingly teach containment to somebody. Because even if he's containing, he's always felt as attacking.
Now it's an interesting question. Like what happens when the victim who has become this free parking space for people heals from it, and what happens to the perpetrator who has or who have parked their negative stuff on the victim?
In most cases, the perpetrator goes sick because they were avoiding their sickness by parasitically using somebody else. And this is covered by a very important term in psychoanalysis called the identified patient. That in a home or in any group, there is one person who is very sensitive, very soft, not loud, who does not know how to fight back or keep quarreling with somebody for hours. He is the soft type, the pastry cake type. And the others are rough and tough types. So what happens is everyone parks their pathological material into him. And he becomes the parking space for the entire family. And then when things start overflowing in him, he goes to therapy. So actually he is the identified patient who is actually a victim, but the real patients are going scot-free. The real patients are roaming about in society as healthy, and actually the healthy person has gone sick because all of them attacked him very difficult in a very merciless way. And all of this is so surreptitious and so invisible that everybody has that plausible deniability. Okay, what have I done? Tell me one thing that I have done. So these things are very difficult to prove, difficult to make out. It's like a passive-aggressive person. Passive-aggressive person will drive you so angry, so irritated that people have gone to depression, people have gone to suicidal ideation. And then if you put both of them together in a marital counseling, and the man says, what have I done? You tell me 5 instances I have done. But everything is so subtle, nothing is explicit and obvious. So unless you really fine analyze it with a fine scalpel and using psychoanalytic theory and having a sharp sense of logic, you can't even make out what exactly is the problem. So what you asked for is, I have seen in people, when the parking space was taken away because the person changed as he grew adult, or after the job he became independent and he was no longer dependent, or in the office and in the social space, he developed power and now that power is spilling over to the home. In that case, the earlier perpetrators develop psychosomatic sicknesses. I have seen blood pressure and diabetes both develop out of this. Now,
This must
obviously,
be very typical in case of parents and children.
correct.
Especially because the parents have used the child as a parking space for a long period of time. And when the child doesn't accept that anymore.
Correct.
But at the same time, the child can't possibly leave home or child can't really retaliate. So this must be a little more
Correct.
tricky in that particular scenario.
Correct. Correct. So this is like the home actually becomes like an anger home. That you have an anger home where everybody is angry. Some are overtly angry and some are covertly angry. And that is where, if the identified patient does not develop a problem and starts giving back, then the erstwhile healthy people go sick. Of course, as I said, blood pressure and diabetes, they are multifactorial. You can't do one factor causality, but this is definitely one of the strong causes that I have seen. So this is very true. This is also true in case of very hierarchical organizations, that the superiors park in the subordinates. And there is a kind of a travel there, that if the subordinate doesn't have good containing capacity, then it flows down till it finds a good container. So in society also, down the economic hierarchy, it flows down. Like aggression flows from top to the bottom. And at the bottom, there is nowhere to go. So that comes out either on family members or in group conflicts. And that is true for entire human society as well, because we generate far more emotions than the containing capacity we have. So as a group, every group needs a conflict after every 20-25 years to release that pent-up aggression. So in human history, we won't find 50 years in maybe a million year of human history where we have not fought each other. It is very natural. It's a characteristic of the species. Group conflict is very much a species characteristic. And there are many factors. One factor is of containment. Second, of course, even more important than containment is how aggression is generated in the first place.
Okay, we come to our last question. Does holistic healing help in this process?
Yes, it does, because most of processes in holistic healing, whether it is yoga or pranayam or meditation, they essentially focus on relaxation and developing that soothing capability and not responding automatically to the stimulus from outside. In a way, to develop the containment capacity and not give into this rapid fire input output thing. So they all help with developing good regulatory capacity and good containing capacity. But regulatory capacity comes easier, containing capacity takes longer time. Second, if we look at the whole idol process, idol worship process or idol therapy process, which is used in various schools, then that helps in internalization of a good, reliable, stable object. Because we internalize a good, omnipotent, safe object. The third is we can go to that idol as a container and empty out ourselves without fear of attack or loss. The fourth is, if you look at homeopathy, then you will have certain medicines which help you, where apart from the containing thing, you will have many other things, and the list of symptoms that you have will get helped by that remedy, and indirectly in some way the remedy will also be working on the containing part of it. If we look at yoga, the relaxed part of yoga done with a teacher, or if one becomes Shishya of a guru and the guru is safe object, then that also helps. So in holistic healing also, art therapy also can help, at least in finding out our authentic self by interpretation of our art, by interpretation of consumption of our art, how we consume art in that sense. So holistic healing can provide us a lot of things, some tools, some techniques, some approaches, and but they have to be combined with therapy.
Yeah, that was going to be my question. I mean, do we combine with therapy, or can you do that without therapy and it might be helpful, or I don't know. It's
As a rule, I would say combine with therapy. As an exception, if you have an exceptionally powerful and gifted and good guru, then maybe you can dispense with therapy. But as a rule, I would say combine with therapy.
And I think depending on the severity of the issue, as you said initially,
Correct.
mild, moderate, and severe. Mild one can be possibly helped or healed with other methods.
Correct.
Okay, Himanshuji. We have covered a very interesting subject. Actually, after having this interview, I've realized that it's such a vast application.
Correct.
The concept is just containment, but it is vast application in all spheres of our existence, I think.
Correct. Like transference, counter-transference, projective identification, they are
Right.
everywhere.
Right.
I mean, you don't have to be in the therapy room. In any human interaction, you can find it happening at most places.
And now, after the concept is little explained, one can actually see it happening in, practical
Correct.
situation around yourself.
You can
And
easily
one can
see,
be more reflective.
yeah, you can easily see a child interacting with the adults and see who is whose container.
Yeah, exactly. Very interesting subject.
Yeah.
And thank you so much for elaborating this interesting concept.
I should be thanking you for having that
Namaste.
point.
Yeah.
Okay.
Okay.
See you then.
Yeah. Namaste.